Hello there. My name is Dr. Monica Ndereto, a family physician working in Kenya, a small country in Africa. And I am into active clinical practice. And due to the persistent need, today I will be looking at just a general overview about thyroid eye disease, which is one of the diseases that occur and constitutes to endocrine disorders in the body. So thyroid eye diseases, I'll probably just go to the introduction, is an inflammatory orbital disorder that is normally associated with autoimmune thyroid dysfunction. Normally, the diagnosis requires the presence or the evidence of eyelid retraction, and additionally, presence of abnormal thyroid function tests, exophthalmos, optic nerve dysfunction, or the involvement of extraocular muscles. However, before the diagnosis is fully made and confirmed, other contributing factors need to be ruled out, eliminated, for us to categorically say that this is actually thyroid eye disease. So, in most of the cases, thyroid eye disease is usually associated with Graves' disease, and this normally results from inflammation, orbital inflammation, from fibroblast activation. This is normally just in a nutshell the whole pathophysiology that normally leads to the formation of thyroid eye disease. So it's normally more common in the females, mostly of middle age as compared to men. And for the men, whenever it occurs, it tends to occur a bit later in their phase of life. The main risk factors that are associated with thyroid eye disease are being female. Being a woman in itself is a risk factor, and also middle age, as I've just mentioned before. And also smoking. Smoking has been found to be a very common risk factor, that patients who take up smoking when they have thyroid diseases ongoing tend to develop thyroid eye disease. Also, treatment with radioactive iodine treatment also poses a risk to the development of thyroid eye disease. But surprisingly or interestingly, also the use of statins, like patients who are on statins, from a few studies, taking statins for other various issues, has been associated with reduction in the chances or in the risk of development of the thyroid eye disease. So the common sign and symptoms, the commonest sign is normally retraction of the upper eyelid, which is usually can be bilateral or unilateral, and this normally occurs due to the chronic eye exposure, and this normally leads to the discomfort, or what we call foreign body sensation in the eyes due to the chronic upper eyelid retraction. And this will normally cause dryness of the eyes and also tearing. And long term, we can have development of severe keratopathy, which can occur, and thereby increasing the risk of scarring, corneal scarring, with ulcerations, perforations, and extrafomitis. The other common signs and symptoms for thyroid eye disease involves exophthalmos or proptosis, which is usually the second commonest sign for patients with thyroid eye disease. And this is it normally happens due to incomplete eye closure. So it is normally seen in about 60% of the people or patients with thyroid eye disease. Another sign that occurs with thyroid eye disease is the extraocular muscle dysfunction, which occurs in about 40% of the population of people with thyroid eye disease, and it causes diplopia. It normally causes, yes, diplopia. So the inferior and the medial rectus muscles are normally the most affected muscles, and they actually contribute to this condition. Then you can have eye pain or dull-like eye pain occurring in patients with thyroid eye disease, but this occurs in just some of the patients, not in all of them. Another small percentage of about 6% of the people will get color vision loss or loss of visual acuity, and this can mostly occur due to compression of the optic nerve. Of note is that threat to eye loss or loss of sight is normally one of the commonest complications of thyroid eye disease, and treatment is mostly to prevent loss of sight in patients with thyroid eye disease. So we have about 2 scoring systems that can be used to assess disease progress and severity. One of them is normally the clinical activity score, known as the CAS, and it normally assesses a few parameters that are derived from the history and examination findings, and it normally encompasses several components, as I shall mention, and each component normally scores 1. These are normally assessed during the initial visit of the patient to the hospital, and these normally involve spontaneous orbital eye pain, gaze-like orbital pain. We can also have eyelid swelling, eye erythema, conjunctival injections, chemosis, and carankle. All these normally are scored. Each scores 1. Each normally carries a score of 1, and for patients during the initial visit, who normally score a score of more than 3, actually show active disease. That is a disease that's still ongoing. That's activity or intervention is normally important. The other scoring system, which is the more current, is normally the VISA classification. It's more recent and also assesses, as I mentioned, disease progress and severity. It encompasses assessment of the vision, inflammation, strabismus, and appearance. So of note is that thyroid eye disease is mostly a clinical diagnosis, and imaging is actually not the gold standard in the diagnosis of this condition. So, however, a CT scan of the orbits can be used to assess the orbital compression. An MRI also can be used to assess the muscles and also fat accumulation in the orbits among patients with thyroid eye disease. Treatment normally depends on the degree of disease activity and also the progression of the disease. And the most important thing first is normally to normalize the thyroid functions. And this, as we have seen from previous studies, normally involves the use of antithyroid oral drugs, the use of radioactive iodine ablation, and also thyroidectomy. All these are parameters that are normally employed in the normalization of the thyroid function test. And also other conservative management include the use of eye lubricants, because as we mentioned about the risk of drying of the eyes, and also use of protective eyewear and sleep masks. Steroids previously have several practitioners normally embrace them, but their use has been controversial also due to their side effects. But in patients with nerve root compression, many physicians have embraced the use of steroids, though its use is usually quite controversial. But many have embraced its use with good outcome. Also, radiotherapy has been used for decades, but however its use is still controversial, with some physicians preferring to use radiotherapy still for the management of thyroid eye disease, and some preferring not to use them. Biologic agents, we have a few like teprotumumab that has actually is the only FDA approved drug in the management of thyroid eye disease. It's very good and favorable outcomes. But for patients with chronic disease, surgery has been previously used traditionally to manage these patients, and this normally involves decompression and all the way to the actual management of this patient, orbital decompression, and this normally results in good outcome. So orbital decompression, then decompression surgery, and eyelid surgery, in that order of sequence, has previously been used among patients with thyroid eye disease to manage them. So this is just a brief overview that thyroid eye disease is a common condition that has been previously been quite difficult, but with ongoing investigations and findings, it has been found to be easy to diagnose and also manage these patients, so at least to preserve eyesight, as we also improve the quality of life for these patients. This is for now the overview of thyroid eye disease. Thank you very much for listening, and I hope that you're going to find this video very useful out there when managing patients with thyroid